GBM is a type of rapid-growing brain tumor made up of spongioblasts or epithelial cells in the nervous system and is highly malignant or cancerous. Risk factors for GBM are abnormalities on chromosomes 10 and 17. It is more common in white people and in men than women. People who have had ionized radiation to the head and people with neurofibrosis types 1 and 2 are at high risk for contracting GBM. Statistics for GBM are that GBM accounts for 52% of all brain tumor cases and only occurs in 2 to 3% of people out of around 100,000 people. The average survival time is about 12 months without treatment and 14 months with treatment. 13,000 people die each year because of GBM, and it runs in families. First-degree relatives have 2 times the risk of getting GBM than anyone else. And there are 2 types of GBM, primary and secondary. Primary is the most common and makes its presence known quickly, and secondary is slow to grow, very aggressive, and accounts for 10% of all glioblastomas.
Some treatment for glioblastoma, or GBM, is a combination of radiation therapy and chemotherapy. If surgery is not an option, the doctor may administer the therapy. Some of the side effects for GBM are headache, neurological symptoms, seizures, hydrocephalus, and behavioral issues. Patients get headaches because usually the tumors are as big as an orange or as small as a grape. The Cancer Genome Atlas discovered information about the role of certain genes in GBM tumor growth. They also gained new insight into the genes controlling important network of molecular signals within tumor cells. And there's no preventions of GBM.
Okay, so as you have previously saw in this video, my associate Brielle talked about the side effects and about how a tumor can get to be about the size of an orange or as small as a grape. There are 3 ways for the doctors to find out whether you have GBM. There is the physical exam, at which point the doctor is going to ask you if you have experienced any of the side effects previously mentioned, like loss of coordination, balance, memory loss, changes in your sight or vision, sound, or smell. If there has been any paralysis, any parts of your body, speech impediments or difficulty talking, problem swallowing, seizures, or loss of consciousness, and headaches. Then there's a CT scan. A CT scan produces multiple detailed pictures of your brain to help locate any abnormalities. The CT stands for computed topography. And then there's the MRI, or magnetic resonance imaging. It uses a magnetic field to show 3-dimensional views of the brain. If you have already been diagnosed with GBM, there's the PET scan, which provides a detailed account of your body, including cells that may be highly cancerous. And it can help a doctor to describe how to remove it. And there's the SPECT, which produces a cross-sectional image of the brain, which cuts about right here. And in order for this to happen, thallium-201, a radioactive substance, is going to be administered into your brain, and it's going to figure out whether your cells are damaged or not, are infected. Glioblastomas usually contain a mix of cell types. They usually contain cystic mineral, calcium deposits, and blood vessels, and other cells. Glioblastomas are usually highly cancerous and have a large amount of its cells are reproducing constantly. They are nourished by an ample blood supply, and glioblastomas come from normal brain cells. It is easy for them to invade and live with normal brain tissues in your cell, and they rarely spread to anywhere else in your body. They are commonly found in the cerebral hemisphere and can be found on your spinal cord. Tumors that arise from astrocytes are star glue-like shaped cells that make up supportive tissue of your brain. There are several instances that are associated with GBM. 7% of primary brain functions, and the chance of catching will increase with your age. 3% of childhood brain tumors are glioblastomas.